Hello, good afternoon. This is Ira Sahai back again with another course review video. And I have with me a very, very special D Life member today. She's Dr. Rekha Konnur from Bangalore. She's now a D Life certified doctor. She has done her course in low-carb nutrition and metabolic health. Dr. Rekha is an anesthesiologist and she has had some health issues in the past. Her story begins from there, and primarily she was suffering from angina along with some other minor issues. Finding no relief and no respite in the normal medical protocol. Dr. Rekha, being a mainstream doctor herself, started thinking about what could be the root cause of it all. That's when the story took a turn and Dr. Rekha started exploring nutrition. Let's hear it from Dr. Rekha herself. Welcome, Dr. Rekha, and many congratulations on getting your certification in low carb nutrition and metabolic health. Please tell us, being a mainstream doctor, how did you come to study nutrition and how did you find that?
Yeah, I was always passionate about nutrition. And once I ended up having a severe angina, that was 18 years back. That is when, no, I did not get any relief from any of the specialists and super specialists. I had to only roam around to different hospitals with different investigations, and the angina persisted for more than 1 month. My ESR was 98 and my resting heart rate was 120. But I did not get any answer from anybody. That is when I started understanding digging more into the root cause, what could be the way. Then I realized that my lifestyle, as well as my nutrition, was not right. So I started making changes, and progressively my chest pain, everything went off. But still, I was not into full, because I didn't have proper knowledge about it. Then I was also diabetic that time. Then after few years, I reversed my diabetes also completely. I know, not reverse. I can say it's a remission. I brought it into remission. So since the past 8, 9 years, I'm not on any diabetic medication also. This all I achieved only through lifestyle change, and then mainly the nutrition, what I can say. Because in that, in your lifestyle, 80% contributes for me nutrition. And I was always passionate about nutrition. I used to listen to various podcasts and all. Then I stumbled upon Satyajit's classes. I enrolled for that also, and through him I came to know about D Life, and I enrolled, and I got a lot of benefits out of it. There is no doubt about that. In spite of knowing, in spite of being in a medical field, in spite of knowing so many things in nutrition, there is tremendous knowledge which I gained from D Life as well. Especially the low carb part, I didn't know. That I got to know only through the D Life.
That's so wonderful and so heartening to know how you have, not only changed the game for yourself. I'm sure so many patients would now be benefiting through your knowledge that you've gained
Yes,
from
yes,
doing
yes, yes.
this.
Yeah.
Dr.
Not
Rekha,
only
many.
patients, all the doctors in my hospital, everybody follows the same thing what I am following. Yeah, I do give them classes, on and off, lectures regarding the health and all. I do small seminars for them. So that, everybody, they appreciate this very much.
Absolutely. So one person learning the science of low carb nutrition and orthoreoptic carbohydrate restriction is benefiting and changing so many lives around her. And Dr. Rekha herself is a mainstream doctor who's using low carb protocol on all her patients, all her colleagues also helping them out. Dr. Rekha, so wonderful to hear it from a doctor. Please tell us, how did you find the course? Now that you've completed the D-Life Diploma course, how did you find the course itself? And what were the things that you loved about the course?
Everything is, I can say it was short, but elaborate also. Because in if you have to go to any other textbook or anything to read about even the micro, the macro, or the metabolism, anything, such a vast topic. Here it is shortened, but yet every point is conveyed properly. You don't miss anything out. It
Yeah.
means it's a more practical, I can say.
Yes. So we begin from the evolution and right up to, whatever you can think about low carb, because T-Life is the biggest
Yeah,
course in the world in low carb nutrition and metabolic health. We have been accredited 60 hours credit, which is the biggest global CPD credit hours given to any course. Dr. Rekha, please tell us also about the forum support and, the support through recipes and the podcast and queries that you may or you can put up on the forum, the mentors that they are there. How's the support at the D Life? Even
No,
while
no.
you were doing the course and now that you've completed the course, you're still part of the WhatsApp group and forum.
Yeah, the support group is excellent. Otherwise, everybody putting out some or the other thing, points, and we get to learn so many things. We see we can't be expert in every field. Yeah, so we the moment that somebody posts something, we learn that there is so much to learn from them as well. Well, it could be a small minor point, but that minor point add value to your knowledge also.
Okay, Dr. Rekha, now just a very important question that I'm sure will give a lot of direction and guidance to doctors as well. You are a mainstream
Mm.
doctor, and yet you needed to go to low carb nutrition and study and get certified in low carb nutrition. Do you think? I mean, obviously there is a gap between the medical protocol and the remissions that you are intending to bring in your patient. Do you think that D-Life perfectly bridges that gap? And after having done the D-Life diploma course, you have increased your practice or improved your patients?
Oh no, the yeah, I think no, I incorporated a lot of D life points also, because this low carb concept I didn't have it before coming to D life. This concept I'm definitely applying, and it has benefited the patients a lot, a lot. There is no doubt about that.
So you would advise doctors to take this course?
Yeah, I would advise definitely. They tell, no, madam, you are their shortcut for us. I we don't want anything.
So, Dr. Rekha, a very interesting question. I mean, I'm asking this to a mainstream doctor. Let's not forget this. Despite being trained in medicine, and she's a very famous anesthesiologist, and yet she needed to learn and get certified in the D-Life diploma course that not only helped her but is helping everybody around her. Dr. Rekha, what would you say, about the course fee? Is it worth it?
Definitely, definitely. There's no doubt about that. And that too, because it's for the Indians. No, you know how picky the our patients end up. It's going to be very challenging if you end up giving something which is a Western food. For the with the Western food, it's very easy to make it low carb if you want it. But with the Indian food, with the mindset, it's very difficult, because we have all the recipe, everything in the recipe PDF. So it becomes very easy to train the patients.
Yes, and Indian LCHF, if you're talking about Indian LCHF, T-Life is the only platform. It's the
Yeah.
biggest platform and it's the only award-winning platform. It's also the only Indian platform to be CPDSO UK accredited. And it's the only platform that is also the SMHP USA approved CMHE provider. So if you're looking at a low-carb nutrition and metabolic health course in the world, we are the best, we are the biggest. In India, we are the only ones. Dr. Rekha, any last words that you would want to say for those who are thinking of enrolling and especially for doctors?
No, no, not it's not only for doctors. Everybody should enroll, because your health, your wellness, it's your responsibility. You should have some basic knowledge. Forget pursuing it as a profession, but you should have your basic knowledge. What is good for you, what is bad for you. Uh, and with the D Life course, they will. I think most of the majority will be able to handle themselves, as well as the family. If each one takes their own responsibility, I don't think you will be having these corporate hospitals and all will not be there, because you will not be you'll solve the problem at the root cause itself. There is no progression into the disease form. The doctor's role come when there is a disease. So we should not allow patients to even land up with the disease. Just preventive. It's a preventive mode. If you take care of your nutrition and lifestyle, I think I can say around 90% of the diseases you can prevent.
That's so wonderful to hear. And that's why I always say D-Life doctors are actually the good doctors in the real sense of the word, because these are the people who have invested their time into learning something only to add value to their patients' lives. These are the people who want to reverse conditions, who want to put conditions into remission. These are the true good doctors that we should be looking up to, and these are inspirational people. Dr. Rekha, thank you so much. And before we go, I'll just wind up a little bit of information so that you are reminded of it and you can take your decision and call about the D-Life Diploma course. As I said, we are the largest content on low carb nutrition and metabolic health. We have 800 plus references in the course itself, which is huge. and 200,000 plus words, 60 plus relevant videos. There's lifetime access to the course, and there is no recertification clause. In India, we are the only legally tenable course in low carb nutrition and metabolic health. So, if you are to practice as a legally certified metabolic health coach, it is only through DLive. We are also India's only CPDSO UK accredited with the biggest global 60 hours credit. And the CPD certificate is recognized in 40 plus countries. So you can also practice as an international coach. We are also the SMHP approved CMHE provider. The course gives you free access to the D Live forum, which is 10 years of premium curated data that no other low carb platform in the world has, and wherein we have 3,000 plus combined success stories, 2,000 plus original low carb keto recipes, 200 plus podcasts. As I said, we are the largest content on low carb nutrition and metabolic health. We have a robust forum of long threads and discussion with mentors where anybody can put up their case or the blood work and seek guidance. And this is all for lifetime. And we also have a 24/7 WhatsApp community where we bond, learn, and have so much fun, of which Dr. Rekha and I are also a part. And so proud and so good to have you in the D Life family, Dr. Rekha. What a journey you have made into back into your own health and the magic that you're creating with low carb nutrition all around you. I wish you all the best. Anything that you would want to say before leaving?
Thank you very much. And on the, I'm very happy I got this occasion on the Guru Purnima, and my sincere gratitude and thank you for all of you, especially all the team members as well as my gurus who taught me so much regarding this ministry.
Thank you, Dr. Rekha. Thank you. And this is Dr. Rekha Konnur from Bangalore. If you want to get in touch with her, she's practicing low carb as well as mainstream medicine. Dr. Rekha, would you want to tell our viewers how they can reach out to you in case they want to?
Yeah, I'll put on a phone number later on because I don't have right now.
Okay,
I'm
no
my
problem.
yeah. I practice at Wellbe is my this center. It's on the Bannerghatta Road. I have a clinic as well as online also I do practice. The details I'll put it on the forum.
Yes, so once we upload the video of Dr. Rekha, we will put down her phone numbers. We'll list it down for our viewers in case they want to reach out to her and seek guidance on low carb nutrition. And Dr. Rekha's email and phone number will all be available under this video when we put it up on YouTube. So I thank you so much, Dr. Rekha, for coming and speaking with me. And today, what a wonderful day, Guru Purnima. Many greetings to you. And I'll be back again with another course review video. Till then, this is Ira Sahai signing off. Bye-bye.
Thank you. Thank you so much. Yeah.